October is National Breast Cancer Awareness Month, and doctors at Sarasota Memorial Hospital are worried about a new trend showing a decline in the number of women who are getting mammograms. When it comes to preventing and surviving breast cancer, the best defense is early detection, and that comes through mammograms. 250,000 people will be diagnosed with breast cancer this year. But if this trend continues, thousands more may have breast cancer that goes undiagnosed. We welcome Dr. James Fiorica, the Chief Medical Officer from Sarasota Memorial Hospital, where he is also a GYN oncologist. Thank you so much for coming, Doctor. We certainly need your advice here. This sounds frightening. What do you think is causing this trend?
Well, we know that we've made major progresses in breast cancer. We've seen a 24% reduction in breast cancer in women ages 40 to 55 years old. And people seem to be spreading out their mammograms rather than every year to every other year. And we don't want to miss that opportunity to find a cancer early and detect it at an earlier stage.
So people are getting a little lax and a little more comfortable, and they're just not going out there to get it?
Well, one, it's laxity. Two, screening guidelines are changing, and people are confused as to how often they should get it. People are scared of mammograms, yet they do save lives. They detect cancer earlier. They save breasts. And statistics have shown that we have been able to do breast-preserving procedures, and we want to continue to be able to do exactly that.
What difference could it make if you go an extra year? Instead of getting checked now, I wait 2 years. What difference could that make if you should have cancer?
Well, it could mean the difference between a smaller cancer and a bigger cancer. A bigger cancer could mean the difference between saving the breast or having to remove the breast. It could mean the chances of lymph node metastasis. So you always want to have that opportunity to catch it early.
Mm-hmm. Now, you brought us some recommendations. These recommendations are from the National Comprehensive Cancer Network. So let's take a look at this now and tell us what this means to us.
Yes, the NCCN, the National Comprehensive Cancer Network, recommends that women should have mammograms starting at age 40. They should have that along with a clinical breast examination from 40 on. In addition, clinical breast exams should be done every 1 to 3 years for women aged 25 to 39.
What difference can this make if we all just take these recommendations and go by them?
It could save a life. It could save your life.
This is an amazing small step that we can take to change our whole lives. Do you recommend also getting tested for the BRCA1 and the BRCA2 genes?
Yes, if people have family histories, personal histories, 2 family members, early onset, less than age 50 years old, multiple risk factors, BRCA testing can actually find that cancer before it even develops. So it's a whole different level of detecting breast cancer. It's before it even develops. It's preventing the cancer from even occurring.
Well, we're getting better at treating it, aren't we? Our chances of surviving breast cancer are improving.
No question. No question. We're doing much, much better as far as survival. We find that the majority of breast cancers patients are living and not dying. We have many, many women in the United States now that are living and treated for breast cancer and are cured of that breast cancer.
Well, we're lucky to be here with Sarasota Memorial Hospital because you have a great program for treating breast cancer and for spotting breast cancer, right?
Yeah, yes, we do our best to try to get the newest technology, to get the newest equipment and the best physicians to be able to read those mammograms. Again, the purpose is to try to detect that breast cancer and save a life.
Doctor, there are many women in my life who I know will go more frequently than, they'll go even more frequently than every year. Is that something individual that they could discuss with their doctor? Is it always best to err on the side of more frequently?
Generally speaking, once a year if in an asymptomatic women, so if the women do not have symptoms and they have a normal exam, it's once a year. If there's something they see on that film, well, then they may have to get it every 6 months or more frequently. There's newer techniques, there's newer type of mammogram equipment. Women should also know their breast density. Breast density is huge. You know, the more dense the breast is, it's harder to detect. And so that's where you get into different technologies to find those cancers or more frequent exams.
So it's good to know that it is in our hands to a great extent. Just get in there and get the test.
Absolutely. We encourage women to continue to get the test to help themselves and help society.
Thank you so much. This is Breast Cancer Awareness Month, of course. And for more information, you can go to smh.com/breasthealth.